Hello, good day everyone. My name is Marvika. I am data analytics student at Career Foundry. Welcome you to my data immersion project preparing for influenza season. As we all know, influenza can have a significant impact on public health, and it is crucial that we have adequate resources to manage the increased demand for services during the flu outbreak. The primary goal of this analysis is to help develop staffing plan for the medical agency that provides medical staff on as on need basis in United States. Throughout this project I have tested historical data for the period 2009 to 2017 to understand the trends, severity and volume of flu cases and assess the vulnerable population in these years. So, with the help of this bar chart, we can see that most of the flu deaths have been reported amongst the age group of 65 years and above. So, let us understand who all are vulnerable and are at high risk in the upcoming flu season. So, children who are under 5 years of age, adults who are 65 years and above, pregnant women, people with underlying medical conditions like asthma, diabetes, heart diseases are considered to be at higher risk. And in US, average flu related hospitalization are no considered to are around 1,40,000 to 9,60,000 per year, and flu deaths that are reported on an average are around 12,000 to 79,000 per year. So influenza is a grave problem in US. So let us understand the impact of influenza on US population in detail in our next section. So as we can see from this box plot that approx 90% of the total deaths have been reported within the age group of 65 years and above. So these age groups are considered to be highly vulnerable and are at higher risk of catching flu. So let us understand the correlation in detail with the help of this scatter plot. This scatter plot shows a strong correlation between the age group of the population and the total deaths that are reported. So, with the R value of 0.857, it shows a strong correlation between the age of the population and total death. That means the more the number of people fall between the age group of 65 year and above report the highest amount of death due to flu in US. So, after establishing the relationship between vulnerable population and the mortality rate, we next granulated our analysis towards the most affected states that may require more additional support in the upcoming flu season 2018. So, with the help of this line chart from the previous year, we have identified California, Florida, New York, Texas, Pennsylvania as the most affected states that may require additional support in the upcoming flu season. So, let us now understand the spatial distribution of influenza in our next section. So, with the help of this chloropeth map, we can see that California is the state that has most of the vulnerable population and has also reported the highest death due to flu. We can now see we can also see the next states that are in line to be that can be considered as the hotspot region in US are California, Texas, Florida, Illinois, etc. Similarly, we have with the help of this heat map identified the states that have most of the vulnerable population, that are California, Texas, Florida, Pennsylvania, New York. These are the states that may require additional support in the upcoming flu season 2018. So, on the basis of my assessment of the historical trends and the statistical analysis, I have forecasted with the help of this line chart with seasonality a minimum 4% increase in mortality rate in the upcoming flu season 2018. On the other hand, I have prepared a list of top 10 most vulnerable population state that may require additional medical support in the upcoming flu season 2018, that are California, Florida, New York, Texas, Pennsylvania, Ohio, Illinois, Michigan, and so far. So I would like to conclude with the following recommendation and next action steps, that as per medical data available, as per historical data available, California, Florida, and other hotspot influenza states may require more additional staff deployment in comparison to other states. And as per CDC, the flu activity in US typically begins around October and peaks between December and January. Therefore, appropriate staffing ratio should be maintained, especially during these months in the hospitals and nursing home in the states where most of the vulnerable population reside. And the next course of action plan would be to monitor other high risk vulnerable population like children under 5 years of age, pregnant women, people with underlying medical condition like asthma, diabetes, etc. They should mandatorily take flu vaccine. We should identify areas within the hospital and nursing home that require additional support, that are emergency department, intensive care units, respiratory wards. These are the departments that may require additional staff during the upcoming flu season 2018. We should assess the staffing needs based on the demand for services on the basis of the factors like number of patients, severity of their symptoms, staffing level as per the historical trend. We should also have a contingency plan in place for in case of any shortage of staff. This plan should include strategies to ensure adequate staffing level, such as cross training, bringing temporary staff on board. So, with these recommendations and next action steps, I believe and I am confident that we can combat the upcoming flu season 2018 and provide better medical facility and quality care to the citizens of US. Thank you so much for your time. A little disclaimer here, I'm a bit under the weather. I'm sorry for the disturbance in my voice. And if you have any comment or feedback, please do not hesitate to drop it in the comment section. Thank you so much for your time.